Breast cancer is a serious medical problem. It's a serious medical condition that everybody needs to know about it. What is a cancer? Cancer simply means that the cells in a particular part of your body or within your body, some of them are beginning to grow out of control, out of shape. In other words, when you have breast cancer, what it means is that the cells in your breast, they begin to grow and they don't obey the law of grow and get replaced or grow and stop. They just keep growing. Breast cancer can affect a man. It can also affect a woman. Now, the question is, what are the causes of breast cancer? Why do people get breast cancer? What leads to breast cancer? Let me take you through that. Then we'll look at the risk factors for breast cancer. 50% of breast cancers may not have any predisposition. You may not have any risk factor, but you can end up with breast cancer. I'll explain this later on. In some instances, genetics. If you are coming from a family where either your woman, your wife, your husband, or like anybody has been diagnosed with breast cancer in your family, this is a major direct cause of breast cancer. What is the reason behind the genetic aspect? Normally, when God created us, in our cells, in the breast, there are what are known as breast cancer genes, BRCA1 and 2. How many of you have heard about BRCA genes before? BRCA1 and 2. If you have heard about it, let me know in the comment section. We have BRCA1 and then BRCA2. All right. Normally, these cells, these genes, they are in the body to suppress breast cancer. However, in some people, whether a man or a woman, what happens is that they get a mutation in these genes. The normal function of this BRCA gene is to suppress breast cancer cells. Now, what happens if for some reason you get a genetic mutation? Mutation means that the normal information that the cells are supposed to carry, they are changed, they are rearranged. If that happens, we say that you have gotten a mutation, and normally it's genetically related. If these BRCA genes begin to change, we say that the person has gotten a mutation. Now, instead of those cells suppressing the cancer cells, now because of the mutation, they will not be able to suppress the cancer cells, and this can let the individual develop breast cancer. Is BRCA1 and 2 mutation, the genetic code that they carry, and therefore instead of them suppressing the cancer cells, they lose that ability to suppress the cancer cells. As a result of that, the mutation inside those genes predispose you to getting breast cancer. Hormonal imbalance is also another one. If you are here and then you get a hormonal imbalance from whatever the cause, please remember this is also another risk factor for breast cancer, and you need to know about that. BRCA1 and 2 mutations, all right? We've talked about positive family history also. Very important. Now the question is, why do some women get breast cancer and others don't get it? That will take me to the risk factors for breast cancer. Risk factors for breast cancer before we now talk about the signs and symptoms. Remember, we are just starting. Number one risk factor for breast cancer, whether you are a man or a woman. Remember, a man can get breast cancer, a woman can get breast cancer. One of the risk factors for breast cancer that I need you to know about is one, your age. As a man or a woman, the older you get, the higher your risk of developing breast cancer. And age is unfortunately something that you have no control over. You cannot do anything about it. As we grow, naturally, our risk of developing breast cancer increases. Why? Because of increased risk of genetic mutations. So because of this, our risk of breast cancer also increases with age. All right. Race. The second risk factor is race. Another important risk factor for breast cancer. When I say a risk factor, anything that when you have or do, it will increase your propensity of getting breast cancer or getting the condition of concern. All right. That is a risk factor factor. And here we are talking about risk factors for breast cancer. If you're a woman and you've had any history of breast lump in the past, this increases your risk of getting breast cancer itself as you get older. So take note of that. Very, very important. Another important risk factor for breast cancer, see that, is obesity. Obesity. If you're a woman here and you keep gaining weight, or a man here, you start gaining weight and you're happy about it, it's a sign of good living. That is what people always say. When they are putting on weight, they say, oh, this is a sign of good living. See that, I am here to remind you that that is very, very unfortunate. Gaining weight is not a sign of healthy living. It actually means that you are not controlling your body. You are allowing your body to dictate itself and take control. And when you gain weight, obesity is something that increases your risk for breast cancer. So take note of that. Anytime you gain weight, weight gain is associated with hormonal imbalances. And this hormonal imbalance that comes with the weight problems eventually puts you at risk of getting breast cancer. Listen to me, especially for those of you who have not yet given birth. Giving birth after 30 years, women who wait until they are 30 years before they give birth, if you're a woman who gives birth after 30 years, the longer you wait before you give birth, women who give birth after 30 years, all right, this increases your risk of getting breast cancer. So I want to remind you, those of you who are always selecting men, changing men, and you don't want to start your family, that alone can make you get breast cancer. Take note of that. Very, very important. Positive family history. If you are from a family where any member has been diagnosed with breast cancer, whether your mother, your sister, your auntie, your husband, whichever, that also puts you at risk of breast cancer. Why? It means that there is a probability that you can inherit some of the mutation in the family line. So take note of that. Very, very, very important. Now let me blow your mind with this one. The women here, especially, listen. I beg you. Alcohol, if you are hearing it for the first time, alcohol, if you are here taking alcohol, according to research, especially women who take alcohol is also one of the risk factors for breast cancer, and you don't want to joke with alcohol. Alcohol has nothing good to give to your body. And those of you who are hearing it for the first time, if you are drinking alcohol, either a man or a woman, especially the women, this is going to increase your risk of breast cancer, and you need to be aware of this. God richly bless you. If today is your first time joining, you are welcome. My name is Dr. Mauko Felix, and today we are talking about breast cancer. We are here to go deeper. Another risk factor is radiation therapy. Radiation. Let's say you had some condition, medical condition, and as part of the treatment, you needed to undergo radiation therapy, right? This radiation therapy, as you receive the radiation has the propensity, it has the potential of changing some of the cells. Because when you receive the radiation, it does not only affect the abnormal cells, it also affects the normal ones. And over time, the normal ones also can begin to transform. So radiation therapy is also another risk factor for breast cancer. We are still on the risk factors. Another important risk factor is this. Hello, is there any woman here who is in the menopause? I want to tell you something. Menopause is not a risk factor for breast cancer, but I want to tell you something in relation to any woman here who is within the menopausal age. Menopause starts from 45 years to 55 years. If you are within that age and you stop menstruating, it means that you are in your menopause. The age for menopause, some women start early, 45 years, but some women can go up to 55 years before they start having menopausal symptoms. Now to the menopausal women, listen carefully. Another risk factor for breast cancer is post-menopausal hormonal replacement therapy. Hormonal replacement therapy. Now, what do I mean by that? When you get into menopause, because your eggs are no more functioning optimally, what is going to happen is that your estrogen is going to drop. And once the estrogen drop, you start getting a lot of menopausal symptoms. In some women, this can become so severe that they go for what is known as hormonal replacement therapy, known as HRT. I want to remind you that at the back of your mind, always remember this voice. Receiving hormonal replacement therapy after menopause also increases your risk of getting breast cancer. Every information I tell you on this platform is evidence-based information. I don't just talk for talking sake. I tell you information that is evidence-based. So if you are in your menopause, before you go for hormonal replacement therapy, please remember that you can go for that and it can put you at risk of medical problems, and one of them is breast cancer. Signs and symptoms of breast cancer. Good. So at the background here, sweetheart, breast cancer is curable. Very curable. Now, the question is, why are people dying from breast cancer, especially our women? Why are they dying from breast cancer when it is curable, when you can have your life back? It all boils down to the signs and symptoms. People don't know the signs and symptoms. Not only that, some of you are aware that something is happening in your breast, but you delay in reporting to the hospital. You are here. You are always waiting for this. But I want to remind you today, one of the problems when it comes to breast cancer is that some of you, this is the problem. You are waiting to find a lump in your breast before you say that, I have breast cancer. Let me remind you, sweetheart, you can have breast cancer without a lump. If you are here, one of the signs is this guy here known as breast lump. You are always waiting to find a lump in your breast before you go to the hospital, before you say that something is wrong. By that time, it will be too late. So take note of that. Nipple discharge, nipple discharge, nipple discharge. Every woman here, every woman listening to me, I beg you, listen to me. There are only 2 instances where we expect a woman to have nipple discharge and we say it is normal. Pregnancy, number 1. Correct. Pregnancy, yes. What is the other one? Lactating. If you are pregnant and there is breast milk coming out, that is considered to be normal. If you are breastfeeding, of course, the baby needs the breast milk, and that is considered to be normal. Now, before I even talk about the breast cancer itself, every woman here listening to me, hear me, hear me. If you are not pregnant, you are not breastfeeding, but you start seeing breast milk coming out, that does not mean you have breast cancer. But I want you to learn something from this. If you see breast milk in your breast, okay, you find a breast milk when you are not breastfeeding, you are not pregnant. See that? That is a sign of hormonal imbalance. And if you don't do anything about it, even though it may not necessarily mean that you have breast cancer, it will make it very difficult for you to get pregnant. All right? So if you're having breast milk when you're not pregnant, you are not breastfeeding, you need to be worried about it. That is a sign of hormonal imbalance. Now, I want us to do an exercise. Listen to me. Every woman here, I want you to hold your boobs. We want to do this practical. All right? If you are not pregnant, you are not breastfeeding, I want you to do this exercise for me. Very, very important. Hold the boobs. Hold it and squeeze it towards the nipple. Don't squeeze on the nipple itself. No, squeeze it towards the nipple. Just hold it, assuming this is it. Squeeze it and see whether you can see any discharge, and give me your response. Everybody do that exercise. Hold it. Hold your nipple, hold your boobs like this, and then squeeze it. Squeeze it, and tell me whether there was water coming out. And if there is water coming out, okay, let me know what is the color. What is the color? Those of you who did it and you are finding water coming out, you are not menstruating, you are not breastfeeding, you are not lactating, sweetheart, go and get your hormonal profile done. Why? That is also among the leading causes of infertility, especially if you're having whitish one. You are not pregnant, you are not breastfeeding, but you did this exercise and you got the color like a milk when you are not breastfeeding or pregnant. That is a sign of hormonal imbalance. The hormone responsible for this is known as prolactin. And when your prolactin is very high, you can't get pregnant. It will make getting pregnant very, very, very difficult. So do that and let us know. Now, when you do it also, if you get white, it doesn't mean you have breast cancer. It only means that you may be having a hormonal problem. And hormonal problems put you at risk of breast cancer, all right? But it doesn't mean that you have breast cancer. But when it comes to breast cancer, if you press your breast and you see nipple discharge, that is bloody nipple discharge, okay, or water mixed with blood, that is a sign of possible breast cancer. Common one is duct ectasis, okay, duct ectasis. Take note of that. Take note of that. Breast cancer is killing women. That is why I am here screaming and yelling. Together we can save people. Together we can spread the good news to them so that they can learn. All right. God bless you. My name is Dr. Mauku Felix. The nipple discharge may be yellowish. Okay, yellowish nipple discharge, that is also abnormal. You need to get yourself evaluated. It can also be yellow with some blood inside. That is also abnormal. It may be white with some blood stains inside. That is also abnormal. You need to get it evaluated. Very, very, very important. Let's move away from nipple discharge. Another sign is dimpling. Thank you so much. God bless you. Dimpling. What is dimpling? So the skin around your boobs is supposed to be smooth. Dimpling. So the skin around your balloons, they are supposed to be smooth all round. Now, if as a man or a woman, you see that, let's say this is the breast, okay? Let's say this is the boob. That is known as dimpling. You see any skin around your boobs going inside, dimpling, all right? All right, that part of the breast, the skin area has indented or indentation. That is also another way breast cancer presents. And sometimes you may be having this without a lump. So take note of that. Very, very important. Now, change in nipple position is also another one. So you are this man or this woman, your nipple is always pointing out, okay? It is always out or it is flat. Now, all of a sudden, you've noticed that your nipple has sunk inside the breast, known as nipple retraction or nipple inversion. If you see that your nipple has now sunk inside, you try to pull it out and it is painful. You try to pull it out, it goes back in. That is also another sign of breast cancer that you need to be aware of. Very, very, very important. Breast pain is also another sign of breast cancer. Let me explain this further. Every woman, those of you who are still in your menstrual period or your fertile period, meaning you still be getting your menses, it is very normal during your menses, okay, midway thereabout, you get what is known as breast engorgement. Okay, your breast becomes very heavy and the tissues become stretched, and therefore you get some slight pain. But if you are here as a woman listening to me, as a man listening to me, from time to time, from nowhere, you'll be getting sharp pains in your breast. It comes like an ant biting something, some of the cells inside your boobs. Okay, it comes and go, sharp pain. Okay, as if there's something there biting you, then it will go, then it will go from time to time. Even when you are not pregnant, you are not in your menses, you are not breastfeeding, see that you need to get yourself evaluated, because that is also another way breast cancer present. Another one is swelling. So you are this beautiful woman, this beautiful mother of mine, this beautiful blah blah blah, yeah, your breast, one of them is slightly bigger than the other. That is very normal. That is considered okay. But now you have noticed that one is getting out of control, becoming bigger and bigger and bigger and bigger. They are just increasing, and when it touches it, it is very, very painful. That is also another way breast cancer presents. Guys, I am doing this because people are dying, women are dying now. So if you've been getting one of your breasts becoming bigger and larger than the other and all that, I beg you, see that, don't wait. Another way breast cancer presents that I need you to be aware of is change in skin color. There is what is known as peau d'orange. Any French woman or man here? Any French woman or man here? Peau d'orange. The skin around your breast begins to change and appears like an orange peel, known in French as peau d'orange. Can somebody spell it? Orange skin appearance of the breast. If you start seeing the skin around your breast appearing like orange peel, that is another way breast cancer appear. Yes, peau d'orange. When you see that in your breast, around your breast, the skin is like the back of an orange. Don't wait. Breast cancer presents that way as well, and I need you to be aware of this. If today is your first time, make sure you click on my profile picture and connect with me. Give me a follow. You learn about diabetes, hypertension, chronic kidney disease, erectile dysfunction, infertility, fibroid, cervical cancer. I discuss them from time to time. God bless you. I am a board certified specialist medical doctor based in Ghana, and today I'm taking you through breast cancer. All right, let's continue. All right, so we've talked about peau d'orange or change in skin texture. Very important. Another one that I need you to be aware of, which most of you are not paying attention to. Let me see if I have a diagram. I should have a diagram. Thank you, guys. Thank you. Good. I believe we can all see this, right? We can all see this. Another way breast cancer presents is lymph node swelling. Swollen lymph nodes. This is what I wanted you to see. Swollen lymph nodes. Very, very important. If you are here and you get any swelling in your armpits, right, that can be also another way breast cancer presents. All right, I've just shown you that picture. I've taken it away. All right, so you put your, anytime you put your hand in your armpit, you find like there are nodules there, small lumps there. Those are known as lymph nodes, and they can be a sign of breast cancer. So take note of that. Now, before I continue, let's recap the signs of breast cancer before we continue. What are the signs of breast cancer that I've mentioned that you are going to remember? Let me see if you guys are following the discussion. Mention one sign or symptom of breast cancer that I've mentioned today that you have heard about. Let's go. Everybody give me one. Lymph node swelling, correct. Lymph node swelling. What again? I mentioned a lot of things, guys. Bloody nipple discharge, correct. Breast cancer, breast lump, nipple discharge. Not all of them are breast cancer, but some of them, most of them can be. What again? Swelling, dimpling, correct. Orange skin. Good. I am happy. Mention if one breast becomes abnormally bigger than the other, that can also be a sign of breast cancer. Now, another important one. The reason why people are dying from breast cancer is not because breast cancer is not curable. Men and women are dying from breast cancer. And I know some men are here. They are hearing it for the first time that breast cancer can occur in men. Some people think that breast cancer only affect women. But let me let you know. Breast cancer affects both men and women. Just that it is more common in the women. Reasons why breast cancer is killing people or taking away lives, it's not because it is not curable, but it's because it is detected very late. And sometimes also, look at the men. The men are now putting their hand in the air. You didn't know. I bet some of you didn't know that you men also get breast cancer. Good. That is why you should be coming to this platform and learn, right? Be coming here to learn. Be coming here to learn. Now, 2 reasons account for breast cancer death. 1, late detection and late presentation. The late detection means that the person does not detect it early, or he goes to the hospital and it wasn't detected. At this point, I'm going to take you through how to do routine self-breast exam. It is very, very important that you know how to do proper routine self-breast examination. Now, before I do this, the women here, have you examined your breast this month? When was the last time you examined your breast? How to do it? Now, so to do a proper self-breast examination, we call it self-breast examination, meaning that you don't need a doctor, you don't need a nurse, you don't need your husband, you need yourself. You are going to examine the breast not by somebody, but by your own self. That is why it is known as routine screen. Let's invite more screen. How do you do it? I know some of you have been doing it, but I want to teach you the proper way. First things first, please always take off your top, all right? Remove it. And take also away the brassiere. Very important. Take that also off, all right? Do breast examination in front of a mirror. That is the first thing. Inspection per patient. But you need to do the inspection of the breast examination in front of a mirror. All right? Stand in front of a mirror. Either you are holding the mirror or preferably a hanging mirror. Take off this ones, take out the bra, and then let the things hang. Let these balls, okay, the watermelon, let them hang freely. Inside the mirror, you are now looking at your boobs inside the mirror. What are the questions that you need to answer when you are doing inspection of the breast, which is the first stage of the breast examination? Number 1, you are going to compare the size of your breast. Is the breast becoming abnormally bigger than the other? Very important. Number 2, you are going to ask, is there any skin discoloration or skin changes around my breast whilst you are looking at it? That is the essence of the mirror. I'll tell you another reason why you should use a mirror when you are doing breast examination for inspection, right? I'll give you the reason later on. Now, the next question is, the nipple, the way my nipple used to be, has it changed? These are ticks that you need to do. All right? Standard breast examination is what I'm teaching you here today. Now, my nipple position, has it changed? My nipple used to be pointing out. Is it now going inside? And when I touch it, does it come out freely? If it doesn't come out freely, that means there is a problem going on. Very important. The next thing that you want to ask yourself, the skin, is it changing? Is there any part of my breast that has become reddened? Very, very important. Is there any area of my breast that has sunken inside or indentation around my boobs? That is also very, very important, right? Is there any obvious nipple discharge? Very, very important. If you are learning and you are not sharing this live stream, you are becoming selfish. Don't be selfish with good information. Let somebody also come and benefit. All right, God richly bless you. My name is Dr. Marco Felix. If today is your first time, please support us by sharing, support us by inviting somebody, support us by tapping. And if you love what I'm doing and you have a gift also, oh, don't say he doesn't even have a wish list. Please support us in any way, either with your fingers, with your whatever. All right, God bless you. Let's continue. All right, so you look at all those things: nipple retraction, swelling, reddening, skin changes, any obvious lump or change in skin color, any indentation, all of them. You look at that. Very important. Now let me tell you another reason why. The reason why you should always try and do the inspection of the breast, which is the first stage of the breast examination, in front of a mirror. The women here, you agree with me that under the breast here, between the breast and your chest wall, okay, between the breast here, the line here and the chest wall, can you bend down and look under there? Answer me. Is there anyone who can look, especially the women? Is it possible for you to look under the space between the breast and the chest wall? Tell me. Tell me. Tell me. Just be very honest. Yes or no? No. Yes, you are correct. It is no. It is impossible for you to hold one breast and bend and look under it. It is impossible. That is the importance of you doing breast inspection in front of the mirror. I hope now it makes sense to you. So that when you raise the breast up, the space under the breast and the chest wall will be shown on the mirror image, and you can still see between the breast and the chest wall. So if you are doing breast examination and you don't like doing inspection with a mirror, there are things that you can miss. Sometimes the thing will start between the breast and the chest wall, and you can't see it. The skin changes may start from there, and you can't see it. I tell you, anytime you come to this platform, trust me, you will always learn something new. All right, so take note of that. Let's continue. Now you finish with the inspection in front of the mirror. The next stage is palpation, which is touch. You are going to touch. Sweetheart, don't be standing in front of your mirror and be holding your breast like this. Yeah? Once inspection is done in front of the mirror, the next stage is touching the breast. And how do you do it properly? This is how you do proper touching in terms of palpation of the breast. Lie down flat, either flat or with a pillow at your back, just to make you a bit comfortable. Now, what do you do? If you want to examine this breast, you are going to put this hand. Let's say I want to examine the left breast. I am going to put the left hand on my head or at my occiput. For two important reasons. Some of you don't do this. That is why I am taking my time to take you through how to do proper self-breast examination. Even if you don't have anything to support us, you tapping, you sharing, that is a support. That is a support. So please keep inviting your friends. Let them come and learn. I want to examine this breast. What am I going to do before I touch? Put this hand on your head or on your occiput. All right? And then, if this is the breast, let's say this thing here is my breast, this drawing here. Let me close the background, okay? I'm going to close the screen so that you can appreciate what I am trying to say better. I want you to appreciate what I'm saying better. Please keep tapping, okay? Keep sharing. This is a very important discussion we are having. We are now on palpation. Palpation, you are now going to touch your breast. I say put one hand here. If I want to examine the left breast, the left hand should go to my head or the back of my head, which is the occiput, right? Then divide the breast into 4 equal parts, imaginary lines, top to down, and then across. This will divide the breast into 4 quadrants or 4 zones, and the middle part is assuming this is the nipple. This round thing is the nipple. So draw a line through the nipple from top to down like that, okay? top to down, one line, top to down, right? Zoo like this. Another one like a cross. All of them should pass through the nipple, right? This will give you right middle upper quadrant, medial lower quadrant, and then outer upper quadrant, and then outer lower quadrant, 4 quadrant, and the nipple area become the 5th region. Now you put this hand here like this or like that, either here or like that. Any of them is okay. Make the examining finger flat. Never go and examine your breast like this. Some of you, that is all you do. Funya, 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 funya. Please keep tapping, even though the comment section is closed. Keep tapping and sharing. Funya, 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 funya. No. Flat. Flat. This hand should be flat. No curve, no bend. Flat. Okay? You are going to use only this part of your examining finger to what? Examine your breast. So you pick the breast tissue like this in your palm, and then from here to here, it should fall from here to here, not at the tips, from here to here. Okay? You pick it like this against the chest wall like that. Then you massage gently, not in the middle of your palm. You want to use your finger, this area. Pick it gently, smoothly, nice and easy. Remember, when this hand was here, this finger, this is where it ended. Or let's say I started from here. This finger ended here. So when I'm moving, you have to move the hand such a way that this little finger will now come and take the place of this one. See, I've pick the breast tissue against the chest wall. Do like that. This finger is here. This the little finger. It is ending here. This one, the index finger, is here. When I want to move my finger, I should move such a way that this little finger will come and take the place of this finger. So this is here. So this goes here like that. The reason is that you don't want to leave any space unexamined. So you go like that again. This is where this finger is ending. So when I'm moving the next time, this little finger is going to what? Take the place of this one. So I go like that. Smoothly, gently. You are going to move in that chronological manner until every part of your breast is examined. Now, when you finish, you are not done. The nipple area is the stand-alone zone. You go to the middle of the breast like that and examine that area also against your chest wall. When you do that, you are still not done. The mistake some of you are doing, which I am taking my time to correct it for you today, is what I'm teaching you. Your armpit, the breast has a tail that goes into the armpit. What it tells you is that if you do self-routine breast examination without examining the armpit, which is the axilla, you have not done it well. Some breast cancers are going to start in the armpit. So you've done your all round, and then you come to the middle, the nipple, you've done that also. You now move to the armpit, and that takes me to another important explanation I need to give you. The reason why this hand should go here is to keep you reminded that you need to go here. If you examine the breast and the hand is like that, there is a high probability that you are going to forget to enter your axilla or enter the armpit to examine it. So you put in your hand here or there or whichever, it will give you a higher index that you need to enter there. Why should you go there? 1, the breast tail is inside there. 2, some breast cancers, when you have swelling or inflammation going on in your breast, they drain into the lymph node groups within the armpits. So because of that, they will become swollen. All right? You can have lymph nodes swelling here, but you don't have any breast lump. So you going there to examine that place also will help you to find out whether you have any lymph node swelling or not. Very, very important. Also, if you are the type who has big breasts and it is hanging, when you do like this, the muscle under the breast tends to contract a bit, and this helps to support the breast for you and makes the work easier for you. That is also another reason why you need to put your hand up. But most important reason is to help you remember that you need to examine the axilla or the armpit of your examining breast. If you want to come here, this one also goes up and this one goes, and you repeat the same process here. I want you also to remember this, sweetheart. The breast has some drainages known as lymph nodes group. There are some in the armpit. There are some also here. So just below the clavicle, the collarbone, you are going to go there and also do what? Examine it. Please, you need to tap on the screen. Share the live stream and tap on the screen. God richly bless you. Having done this, you are not done yet. The breast examination ends with nipple expression. I told you, nipple discharge is one of the signs of breast cancer. Because of that, you cannot say that you have done breast examination without expressing the breast to see what type of discharge, if there is any. How do you do it? So, you hold the breast between your two, the back of your hands, and then you start squeezing it towards the nipple. All right, and then you look out for any presence or absence of nipple discharge. The best one is no discharge, but if there is discharge, you now need to know what type of discharge am I having. Depending on the type, it may suggest you have a hormonal imbalance, which can make getting pregnant very difficult for you, or you may have high risk of breast cancer. If it is bloody or yellowish mixed with blood or whitish mixed with blood, that is highly likely that your cells are changing. But if it is just pure milk, it may likely suggest that you are either pregnant, you are either breastfeeding, or you have a hormonal imbalance. My name is Dr. Mawuko Felix, a specialist medical doctor from Ghana. Now let me tell you, has this been useful? Is this how you've been doing? Have you been doing everything that I've told you today? I know it's a no. You've been doing it, but not the way we have taught you, the way it's supposed to be done. This is how to do standard breast examination, and it has to be routine. As a woman, every month you have to make it a habit. Sister Yala J, God bless you. It's been a while. Myself, I've not been so active these days on the app. Right? Yes, somebody is saying that I've learned a lot today. Not only today, Adeyemi. Anytime you find me live and you are free to hop in, you always get something valuable for your time. Remember, guys, tomorrow I'll be on Mrs. and Mr. and Mrs. Williams' platform, my mom's platform, and I'll be talking about chronic kidney disease as a specialist medical doctor. Come and learn about the condition that is about 800 million people are having chronic kidney disease, and every year over 1 million of people die from chronic kidney disease. Tomorrow I am going to break it down for you, and if you want to make it easy, connect with her, go to your bio, there is a link there you can register. Also click on my profile picture. Those of you who are first timers here, you don't want to be missing my live stream, click on my profile picture and then give me a follow and turn on notification. You learn about diabetes, asthma, hypertension, breast cancer, cervical cancer, you name it, kidney problems, UTIs, infertility, erectile dysfunction. I discuss everything here from time to time. God richly bless you. Now, having said this, the question now remains, how do we diagnose breast cancer? How is the diagnosis of breast cancer made? How is the diagnosis of breast cancer made? Guys, I want everybody here to type this word. Everybody. If not, I'll go to sleep. The diagnosis of breast cancer starts with me. I want you to type, it starts with me. Somebody is talking about mammogram. No, 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 no. It starts with me. I want you to put that in the comment section. It starts with me. Put it down. It starts with me. That is the key message I want you to have. It is not a doctor who has to diagnose the breast cancer for you. The diagnosis of breast cancer, I want it to be sinking in your head that it starts with me, Dr. Felix. It starts with you, my mom, Mrs. William. It starts with you, all of everybody here. All right? How do I mean? That is the essence why we talk about routine self-breast examination. The reason why women are dying is because you don't examine your breast and therefore it is diagnosed late. You get to the hospital and it is already late. If you make routine self-breast examination part of you, you will be the first person to suspect breast cancer and you report to the hospital early. That is why I said write the statement, it starts with me. Right? So you examine your breast, there is pain, there is lump, there is blood coming out, the skin around the place has changed, the skin has gone inside, it is indented. It starts with you. This gives you an idea that there is a possibility of breast cancer going on. All right, so take note of that. All right, take note of that. Very, very important. Let's continue with that. Now, having said that, if you have any of these signs, you now go to the hospital. When you get to the hospital, what do? We do routine self-breast examination. You know, the whole world, it is only us, the medical professionals, the nurses, the doctors, who you can go to the hospital and we tell you, Madam, give us the breast to examine, and you say, yes, sir. Am I lying? Is it not true? It is true. All right. So when you go to the hospital, our doctor, my breast is paining me, or nurse, my breast is paining me. The first thing we are going to do is to do breast examination using our fingers. Missy is saying that it is true. Yeah. Some of you, even when your husband want to do with the breast, you'll be taking it away. Leave my breast, but when you go to the hospital and the doctor says, I want to do breast examination, that one, oh yeah, you just remove and give it to the doctor to examine. You see your life. You see your life. Good. Don't be starving your husbands and your partners. Stop running away with your breast. Let them enjoy the breast. It will help you a lot. God bless you. So after doing the breast examination, we are going to do further investigation. Why are you people laughing? But it is the truth. It is the truth. It is the truth. Some of you, when your partners try to touch the breast, you just pick it away from there, you pull it away from there. I know, we know. In the night, they try to put their hands under the bedsheet, the duvet, to just have a feel, have some warmth, and then you draw it away from there. Stop doing that. Stop being stingy. Stop being stingy. So stop being stingy. That is not fair. It is part of the deal. Let's continue. Let's continue, guys. Welcome in. This is Dr. Marco Felix. Today I'm taking you through breast cancer and all that you need to know. Please share the live stream, guys. This is an important live stream. Let's share the live stream. God richly bless you. We are going to start with question and answers very soon, and you get free consultation very soon. If today is your first time, please click on my profile picture and give me a follow. You are going to learn a lot on this platform from a specialist medical doctor, and that is me by God's grace. Let's continue. So after we've done the self-examination, we are going to run some tests. We do a lot of hormonal tests, okay? We also do a mammogram. We do hormonal profile. Missy, God bless you. We do hormonal profiles, okay? Then we can also run some genetic tests. All right? Very, very important. We can also do CT scans, okay? Or bone scans in general to see how far the cancer has spread, right? Now, We now have to do what is known as staging. Management of breast cancer depends on the stage of the cancer. The stage of the cancer, all right? We can stage it. Remember that earlier it is diagnosed. When you have breast cancer stage 1, stage 2, it is easy to manage and cure. When we suspect breast cancer also, sometimes, depending on what we are thinking, we can do biopsy, all right? Biopsy to know which type of cancer the person is having. We just plan the surgery, but before surgery, we'll put you on chemo. We can put you on chemo. So let's continue. So, sometime also, depending on what we are thinking, we can do what is known as needle aspirates. Needle aspirates to go and look at the histological cells, the cell types inside the breast to help us know which type of cancer that the person is having, and also whether this cancer is actually amendable to chemo or non-chemo sensitive, all right? Whether it's sensitive to chemo or non-chemo sensitive, all right? Then we take it from there. From there, so the histological appearance take us to grading, okay? That is grading. That tells us how cells have changed from their normal one. The staging is how far the cancer has spread. That is known as staging. God bless you. Now, from there, we now define the mode of treatment. The mode can be either chemo, all right? Chemo, after chemo for some time, up to 6 months or 3 months in cycles, then we go and do surgery. The surgery will depend on the stage of the cancer. If the cancer is limited to just a lobe, we will do what is known as lobectomy. We just remove that lobe of the breast, right? But if the cancer has advanced or it has spread, then we'll put you on chemo for some time, all right? After that, we plan surgery and go and do what is known as mastectomy, removal of the breast. Sometime even after the surgery, we do what is known as radiation therapy to make sure that we reduce the tumor burden, also reduce the risk of recurrence of the tumor. All right? But all in all, I need you to understand something, that breast cancer is curable, but this curability depends on the stage at which the cancer was diagnosed. Very, 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 very important. Nobody needs to die from cancer, guys. Use sharing is a support, okay? God bless you. God bless you. Everybody, God richly bless you. Sharing is one thing that is so dear, so that somebody can come and learn. That is what I plead from you. The more likes we have, the more people can come. You agree with me that some of you have paid money, but even where you paid the money, you didn't get information like this. All right. So having said all this, remember, guys, remember, the diagnosis of breast cancer starts with you. Breast cancer is curable. Breast cancer is treatable. No man or woman needs to lose his or her life to breast cancer. But unfortunately, that is what is happening. And I speak to you. Let me show you this diagram. I think, can somebody see this? In 2023, this year, in the United States alone, according to Cancer Society of America, right? In the US alone, by the close of this year, this is new cases, so not old cases, new cases, 297,000 plus new cases of breast cancer will be diagnosed this year. Imagine that. Queen, thank you so much. Yes, this helps us to go into the popular list. Queen, thank you. Queen Esther, thank you so much. Thank you. This bracelet helps us a lot. It will help us in the popular list. God bless you. So please, this is not a joke. It could be your mother. It could be your sister. It could be your wife. It could be your grandmother. So when you come and we are here doing this live stream and we ask you to share, to invite people, tap on the screen to send more likes. We just want to do this to serve humanity, right? We want to help humanity. That is why I devote my free time to be doing this for everybody here. So when you come, anyhow you can support us. Please, if it touches your heart, go ahead and support us. God richly bless you. Let's continue. So in a nutshell, what have I said today? Let me summarize it without any talk, and then we do free consultation and you ask any question that you have. My name is Dr. Mauko Felix. If today is your first time, click on my profile picture and then give me a follow so that you can find me subsequently. Diabetes, hypertension, breast cancer, cervical cancer, erectile dysfunction, infertility, uterine fibroid, polycystic ovary syndrome. I discuss all of them on this platform. I discuss them here from time to time. Blood pressure management, you name them, I discuss them here. So give me a follow so that you can find me when the need be. Sometimes you have a question, you just write it on a video, okay? And I'll do a video to address that concern of yours for me. So give me a follow if you don't mind. God bless you. So let me summarize what I've said today, then we start free consultation and question and answer session. God bless you. So we said that breast cancer is a very common cancer. Apart from skin cancer in the US, breast cancer is the next one, right? And is among the leading causes of cancer death globally, right? Take note of that. Very, very important. And when it comes to the women, breast cancer is the leading cause of cancer death in the women. Very, very important. Cervical cancer is also down there. Lung cancer is also there. But breast cancer is a monarch, right? Take note of that. Then we say that cancer simply means that the cells in the breast, right, have begun to grow out of control. And because of that, what happens is that they don't obey the law of grow and get replaced. They just keep growing, keep multiplying. And the bad thing about cancer cells is that the immune system is not able to detect them well and take care of them. So they just keep propagating each other. God bless you. Then we talk about some of the direct causes of breast cancer. We said that in 50% of breast cancers, in most times, you don't have any reason. There is no cause for it. You just develop it sporadically. Right? Take note of that. Now, in some instances too, the causes are genetic causes, okay? Genetic causes, all right? The cause may be genetic. If you are from a family where any member of your family, whether your father, your mother, your sister, anybody, remember breast cancer affects men also, all right? This can also lead to problems and put you at risk of breast cancer. So take note of that. Then we talk about hormonal imbalance as a direct cause of breast cancer in women and both men. I was surprised today to know that some men were saying that they didn't know that breast cancer affects men. Now you know. Breast cancer also affects men as well, right? So genetic can cause that. BRCA1 and 2 mutation, which has a genetic predisposition, can lead to breast cancer. Then hormonal imbalance can lead to that. Then we talk about risk factors. We said risk factor number 1 is age. The older you get, the higher your risk of breast cancer. Take note of that. Race is also another one which you cannot do anything about. Then we talk about positive family history of breast cancer. That can also lead to that. Then we talk about previous history of breast lump. If you had a lump in your breast in the past, whether it was cancerous or non-cancerous breast cancer, this can put you at risk of getting breast cancer. Take note of that. Then we talk about what do we call it? Radiation therapy. Radiation. If you receive radiation therapy for any medical condition, that can also be a direct risk factor for breast cancer. Then we talk about obesity, weight abnormalities. This leads to hormonal imbalances and this puts you at risk of breast cancer. Then of course, we talk about alcohol consumption. People were surprised when they talked to them that when I mentioned that alcohol consumption leads to breast cancer or increases your risk of breast cancer, people were surprised. So take note of that, right? People, women and men, the more you drink, the higher your risk of getting breast cancer. Then we talk about late pregnancy, sorry. You are a woman who started giving birth after 30 years. This increases your risk of breast cancer. So take note of that. Very important. Late menopause, okay, also increases your risk of breast cancer. Then we talk about postmenopausal hormonal replacement therapy. This also puts you at risk of what? Getting breast cancer. Then I told you that early menarche, women who started menstruating very early, let's say before 12 years, this also puts you at risk of breast cancer. Is this not good information that we are giving to you? You tell me if it's not true. We give you quality information, well packaged, and you always learn something. Trust me on that. Then after that, I went on to talk about the signs and symptoms of breast cancer. Here I told you that do not rely on a breast lump, because breast lump in most cases, contraceptive pills, no, contraceptive pills, they have some risks, but the most risk is women who are in their menopause and they go for hormonal replacement therapy. All right, that is what has been known to has a higher risk for breast cancer. All right, but contraceptive pills on its own, if it's actually well tailored, their risk is very, very less. It is there, but very, very less. But if your mother is in the menopause, your wife is in the menopause, or you have somebody in your family, a woman who is in the menopause and goes for hormonal replacement therapy, normally estrogen, all right, that can increase their risk of breast cancer as well. So take note of that, right? Let's continue. Then we talk about the signs. We said that breast lump could be a late sign, so don't depend on that. Don't wait until you have a lump. Nipple discharge, dimpling, all right, redness, nipple retraction, breast pain or nipple pain, or changes in the skin color, which is normally the pudor orange appearance. We talk about lymph node swelling and all that. Very, very, very important. All this could be a sign of breast cancer. Welcome back, ma. So take note of that. Now, another important thing that I mentioned to you is that breast cancer is curable, but it depends on you. It depends on you. It depends on you. Early detection. Here I told you that one thing that can help you detect breast cancer very early is when you make self-routine breast examination part of you. What did I say? I mentioned to you that to do self-routine breast examination, stand in front of a mirror for the inspection. All right, stand in front of a mirror so that you can see between the space between the breast and the chest wall, because under the breast, if you are not careful, you never look there. But when you stand in front of the mirror, the mirror image can help you see under the breast once you lift the breast, in addition to looking out for all these signs that I talk about, right? So after that, you go to palpation. Palpation means you are going to touch and feel, right? We said that put your hand here, all right, and then divide the breast into 4 parts. Then your fingers should be flat. You are going to not your palm. You are just going to use this part, okay? This part from here to here, okay? From here to here. That is what you are using to, right? So you do that flat. Pick the breast tissue and attach with the chest wall. Make sure you don't leave spaces in between. Symmetrically go round, whether you're a man or a woman. Remember, men also get breast cancer. Take note of that. All right, then after that, you go into the armpit and examine the armpit for any lymph nodes or any swellings within the armpit. Who knows the reason why you should go into the armpit? I mentioned 2 things. What are those 2 things? What are the 2 reasons why you should go into the armpit? What is the reason that I gave? Why should you go into the armpit? Lymph nodes, number 1. Number 2, what is the other one? Yes, swollen lymph nodes can be a sign. Correct. What is the other reason why you should your breast examination is incomplete if you don't examine the axilla or the armpit? There's another reason why the breast has what is known as a tail, the mammary tail, okay? And this goes into the armpit around this area. It comes like that and continue. So if you're a woman especially and you do breast examination without going into the armpits, all right, you can easily miss it.